content is not intended to be a substitute for professional investing advice. Always seek the advice of your financial advisor or other qualified financial service provider with any questions you may have regarding your investment planning. John Mintz does not provide tax or legal advice. All decisions regarding the tax or legal implications of your investments should be made in connection with your independent tax or legal advisor.
Have you ever wondered why the rich get richer and others don't? Could it be that a small percentage of the population pay others to find, study, and execute on legal loopholes that exist with our financial life and make it easier for them to prosper? The answer is a resounding yes. This is the Secrets of the Wealthy podcast with John Mintz. John has spent a lifetime researching and mastering the financial loopholes that he believes should be available to everyone. Join us as we explore different strategies that help you get farther faster towards building and enjoying a prosperous retirement.
Hello and welcome to the Secrets of the Wealthy with John Mintz. Today I'm excited. John has a special guest on the show today. That is Casey Oliveira. Casey has been in the insurance industry since 2005, offering a variety of health insurance solutions for individuals, seniors, and small businesses. This means she can help with individual health insurance, Medicare plans for seniors, and employee benefits for businesses with less than 100 employees. John, this is fantastic. Why'd you bring Casey on the show today?
Oh, many reasons. I'm really excited for this show. Casey has been handling both my business and my household personally, as far as our health insurance goes, for years. I don't know how long, but it's
Nice.
been a while. And to say that she is the best in the business would be an understatement. I get questions almost daily, especially from seniors, about their fears with insurance coverages, gap coverage or Medicare coverage or whatever it might be. And I just thought what a great idea it would be to have her come on here today and share some of her secrets as it relates to hanging on to our wealth so that it doesn't go to the insurance companies and if it doesn't need to. So here we are. So looking forward to it.
Great. All right. Well, I'm here to learn.
I'm so thankful to be a resource to you.
Yeah, well, welcome, Casey. Casey, there are so many folks out there that do what you do. And I know how I feel about you, but you could say I'm biased. But tell us what sets you apart from, other folks in the industry.
I'd say my years of industry experience and mostly my heart for helping people is what sets me apart. I consider myself an advisor, not a salesperson. So you can expect my honest opinion and for me to take the time to get to know you and learn more about you, to get to know your needs, and that makes this entire process easier. I'm licensed in over 25 states, and I'm contracted with just about every carrier that's available. So that's one of the things that sets me apart. I've been able to roll with all the changes in the industry throughout the years. So I'm always learning and staying on top of all the changes.
Wow, there's a lot of changes. I don't know how you do that, but you probably don't sleep much. But you're licensed in 25 states. I didn't know that. But it explains to me why you're as busy as you are. But you can't help everyone, obviously. I know I can't help everyone, but neither can you. So who would you say is your ideal client, Casey?
Honestly, I have options for just about anyone in any age, healthy or not, on any budget. So I find a lot of joy helping people understand their Medicare options. I'm not a pushy salesperson trying to meet a quota, so I make it more of a learning experience for them. I enjoy helping, small businesses provide employee benefits. That's another area that I specialize in. I love employee enrollment meetings, explaining benefits to them. I just try to make this process easier for the employee. I support the HR department in this department, making myself available to employees that have questions. I'm also certified on the federally facilitated marketplace. So this means I can help people that are under 65 check for tax credits on exchange, and those tax credits help lower their premium. So I've been able to help so many people that did not think they could afford health insurance find lower cost health insurance plans. And then I even have PPO plans available for clients that can pass through underwriting that maybe they make too much money to qualify for a tax credit and they're looking for a PPO network.
Well, I want to circle back with you a little later. Don't let me forget to talk about Medicare and when's the best time, that somebody should be chatting with you about Medicare. But, earlier this year, I know you mentioned to me that this year was different than other years for health insurance in particular. Why is it so different? What makes this year different than other years?
My gosh, there have been so many changes this year due to the American Rescue Plan Act that went into effect in March. And what it did is it created a special enrollment period to enroll in health insurance until August 15th of this year. Normally, individual health open enrollment is November 1st through December 15th each year. So I've been able to help people enroll in health insurance almost all year long. One of the other big changes is this act has eliminated what they call the subsidy cliff. Used to, tax credits were only available to households within 400% of the federal poverty level. So it extended that up to 600%. So I've been able to help people who previously did not qualify for a tax credit get help lowering those health insurance premiums. So it changed how much the benchmark cap was on how much they're allowed to charge you for health insurance premiums and what's deemed affordable or not. And COBRA assistance for assistance eligible individuals. So people that were maybe laid off after March of last year that probably couldn't afford to go on COBRA after that layoff, they have allowed them to go on COBRA starting March 1st of this year with premiums paid for by the employer through a tax credit. So crazy changes. I've never seen the industry this way before.
Oh, wow. So the subsidy cliff, which I've never heard of before, that would definitely be a secret for those that want to be wealthy. So that's
true.
awesome. That's great news to hear that. Well, you mentioned open enrollment, of course, and how that period's extended. When are these enrollment periods, and are they different for different products? So, for example, if you could, this would be maybe a good section where you could expand on Medicare for us a little bit too, as far as, is there an enrollment period for that also? And is there a best time for people to start chatting with you? A year before, 3 years before? Is it, when are they too late? Those types of things. Can you enlighten us on that?
Absolutely. So when you have somebody that's turning 65, we can start looking into options into Medicare about 6 months in advance. So 6 months before you turn 65, ideally you let Medicare and Social Security know that you want your Part B of Medicare, which is a very important part of Medicare, at least 3 months in advance. That way everything's in place, and when you turn 65, you've got everything set. Once you're already established in Medicare, open enrollment is October 15th through December 7th. But we can start previewing next year's plans October 1st. So that's kind of when it all starts. We can start evaluating options. I typically will have a phone call with my clients. I will get updated on their needs, especially their medication. You don't have to worry about shopping your Medicare supplement during this time. You can do that anytime throughout the year. But your prescription drug plans or Medicare Advantage plans, those are the types of plans we're shopping during this open enrollment period.
Okay, so I want to break down the Medicare thing just a little bit, because I get these questions a lot. So I just heard you say if they need to make certain notifications to Medicare or Social Security at minimum 90 days in advance. So if I had somebody in my office, which I did this week, that's turning 65 in September, they need to be talking to you like right now. Is that correct?
Right now. That's right. Social Security is super behind on processing requests to have Part B. So you've got Part A of Medicare. That's the hospitalization portion of Medicare. It's typically automatic and at no cost to you because they've paid in to Medicare all their working life. However, Part B is only automatic if you're already collecting Social Security. Most people aren't. So if you're not collecting Social Security, we have to let them know that I want my Medicare Part B to start when I'm 65. That has a premium associated with it. It goes up a smidge every year, but right now it's $148.50 per month. They bill you quarterly if you're not collecting Social Security. And so letting them know you want that Part B is a process. It's an easy process online, and then we have to wait on them to process it. It's an even longer process if you are over the age of 65 and maybe you've had employer coverage covering you and you're coming off of that employer coverage. You have to send in an extra form to show them that you're losing employer coverage. You have to get that from your employer, and all of that takes time. All of the Social Security is still working from home, and it's just it's a longer process than normal these days.
Okay. So, and wow, that's just great information. What if somebody is too late? Is there a way to to still participate? As we're talking about Medicare still, is there still a way to undo the mistake, or is it just too late is too late?
Well, you can. It comes with a penalty. So if you miss out on your opportunity to enroll in Part B, so you've got 3 months prior, the month of turning 65, and then 3 months after to let them know you want your Part B. Now we can get way detailed into that because when you let them know determines your Part B effective date. But if, say, you miss out on that opportunity altogether, there's a general enrollment period every year. You have to let them know by early in the year, January, February, March, that you want the coverage, but they won't allow you to have it until July 1st. And they will charge you a 10% penalty for every year you could have had Part B and did not. And that penalty is there forever.
Wow. Next question. Let's just say somebody has already started Medicare and, Part B and D, and then they have some long-term capital gains that need to be taken care of. And, for folks who don't understand what that means, it just means that I've had an investment, let's say as $100,000, and now that value has increased to $200,000, and I decide to sell out of that investment. So there's a $100,000 gain that's going to be taxed, subject to long-term capital gains, which will increase my, taxable income as far as capital gain standpoint, meaning that it could also increase my Medicare surcharges, right? Mm-hmm. So the question is this: if that happens, and I don't know, maybe you can help us on this. Does the IRS look back 1 year? Do they look back 2 years as far as your returns go? And then the second part of that question is, if my Medicare charges go up temporarily because of that claiming those gains, and then my income, my income would come right back down the following year because I don't have any gains. Does that mean my Medicare charges will come back down as well, or is it once I go up, it's going to stay there?
Well, they look back 2 years. So there's a chart that we can look at. It'll show us the different income brackets for individual or married filing jointly. And if you make above the standard, so $88,000 for an individual, or married filing jointly is $176,000. If you make more than those amounts, they will charge you more for your Part B premium. Whenever you have a special situation like that, and your income comes back down, we can send in an appeal, and we're basically appealing due to a life change, which change in income, we can kind of get that in there, and we're asking them to take a look and review, and we have to show proof that the income has gone down for them to reconsider that additional adjustment amount that they tack onto your Part B premium.
So isn't that kind? They automatically increase us, but we have to appeal to decrease.
Yeah, we don't want to wait on them
surprise,
to
surprise.
reconcile. Yeah, surprise.
Yeah, okay. Wow. It's like they take deductions away from us when they lower our taxes, but then they increase our taxes. They don't give us the deductions back, do they?
No.
Well, okay, that's great. Well, on a previous show, Casey, I had one show completely committed to and centered around financial planning myths. And I think this might be a good opportunity for you to spend a few minutes telling us maybe one or two of the common myths about your profession or field is, and maybe how you could let people know those just aren't true.
Well, I think when someone thinks of an insurance salesperson, they're probably cringe a little bit because they don't know what to expect, or they expect someone pushy. That's absolutely not me. I'm very patient. I'm dedicated to changing your opinion, or my client's opinion, of this industry. I put their needs first, and I look for solutions that's going to fit their needs and their budget. So it's not about selling. It's about solving problems and finding solutions and educating people on their options. So you'll never feel pressured by me to make a decision or to buy anything. I think I'm very knowledgeable in my industry. I'm patient, I'm honest, and I'm kind, and that's what you can expect when you work with me. And then that does set me apart from other agents, especially if you're dealing with a call center. You're never going to talk to that person again. And I strive to be a resource continually to my clients, making myself available, my team available to them. So that's one thing that kind of sets me apart there.
Yeah, I would second all of that, but I'd also say that you've always made me and my wife feel that you genuinely care about us, and I think that's something that gets lost, especially when you're dealing with as many transactions that you deal with in the short amount of time that you deal with them. Some years, somehow you've always made us feel like we were your only client, which I think sets you up. And I've always told Leah, my wife, I said she must never sleep. So I don't know. But
open enrollment, that is very true. It's a very busy time, but I do care about what I do so much. That means a lot to me.
Awesome. Well, what's one thing you wish that you would have known, if you circle back, and you know what you know now and what you didn't know then, but when you first started in this line of work, what's the one thing you wish you'd have known then?
Well, the other industry professionals are not my competition. There's so much to learn from each other, and there's so many people in this country that need help with this. We're in this to help each other and to learn from each other and support each other. And when I first got into the industry, learning from others, that just wasn't the case. So I wish I would have known that in the very beginning, but I definitely know that now. I've got some amazing people like you to lean on, other insurance professionals in my area. It's just been such a blessing to me to have them by my side and to learn from them.
Awesome. Well, I wish we could have a lot more time today, which tells me that we're going to definitely need to have you back for another show if you're open to that. I'd really appreciate that.
Absolutely.
Great. Well, I could keep going forever, but we're going to cut it short today, and we'll circle back again, Casey. And I've really enjoyed my time with you. I don't want to close today, though, before asking Eric. Eric, do you have any other questions for Casey today?
Yeah, I do, and I appreciate the opportunity. Casey, I know that we spoke a little bit before the podcast even started, that there's a lot of misinformation out there. What would you say are some of the biggest pieces of misinformation that the public is hearing, whether it's by word of mouth, social media, things that they're finding through phone calls, that they need to be aware of so that they make better decisions and actually meet with a professional like you?
Well, I definitely, I've received a lot of phone calls lately from a lot of call centers. They seem to think I'm turning 65. And so I've let them talk to me just a little bit, just to see what do my clients hear? What are they talking about? And they say they're bombarded with phone calls, and it's just so overwhelming. And I feel like they're almost willing to say anything to mislead you, even to say, we've got an amazing Medicare supplement. And it covers this, and this, and they're it's a little misinformed. It's not a Medicare supplement. That's a Medicare Advantage plan that they're talking about, covering dental, vision, all this. So it's no wonder people are confused and they don't want to take these phone calls because you can't trust some of the information coming through. You can tell they're just trying to sell rather than educate and find a solution that's actually going to work well for their needs.
Gotcha. No, that makes a lot of sense. And if somebody is listening to this and saying, man, I'm getting those phone calls, whether you're 65 or not, I want to know some honest answers. How do they get a hold of you so they can ask those questions?
Well, they can always get a hold of me by reaching out to John. He's been really great about introducing me to people so I can help them further. Or they can contact me directly by phone at 682-667-5865. Or my email is Casey, that's CASEY, at axisfin.com. That's AXISFIN.com.
Great. Thank you so much for that. And then, John, how do they get a hold of you?
That's John Mintz, M-I-N-T-S. I always tell people it's like the peppermints, right? So how you remember it. But you can reach our main number, 817-225-6260. And any of our staff will be delighted to talk to you. Or you can go to our website, which is Biltmore, Biltmore, at Biltmore-financial.com. That's Biltmore-financial.com.
All right. Well, thank you so much, Casey. Thank you again for being a wonderful guest. John, of course, thank you so much for bringing her on the show. And of course, our last thank you goes to you, the listening audience. Thank you so much for listening to the Secrets of the Wealthy podcast with John Mintz. If you have not subscribed to the podcast yet, please click the subscribe now button below. This way, when John comes out with a new podcast, it'll show up directly on your listening device. This makes it much easier to share these podcasts with your friends and family. And if you've got friends and family of this age, around this age, where they need to have this information, please share this one with them. They're going to thank you. Again, thank you so much for listening today. For everyone at the Secrets of the Wealthy, this is Eric Johnson reminding you to live your best day every day. And we'll see you next time.
Thank you for listening to the Secrets of the Wealthy podcast with John Mintz. Click the subscribe button below to be notified when new episodes become available. The information covered and posted represents the views and opinions of the guest and does not necessarily represent the views or opinions of John Mintz. The content has been made available for informational and educational purposes only. The content is not intended to be a substitute for professional investing advice. Always seek the advice of your financial advisor or other qualified financial service provider with any questions you may have regarding your investment planning.